Hi everyone, this is Professor Lunger, and I just wanted to go over with you how to develop your algorithm and also what to include in your major recommendation section. So the first thing I have here for you pulled up on the screen is your algorithm cheat sheet. This is also included in your Blackboard course, but this basically goes over the symbols that you can use in your algorithm, what to kind of use where. So I'm going to go over this briefly with you, but again, it's for reference in your Blackboard course as well as a document. So the common flowchart symbols, aka the algorithm symbols, first is an oval-like symbol or an ellipse. This is to denote the beginning or the end. So you're going to use an oval for the beginning of your algorithm and also for the outcome met, the end of it, okay? So, and I'll show you examples of this, but this is going to be the beginning and the end. You're going to have an oval. A rectangle is to show process. So if you start up here and you have your patients listed here and what kind of population you're using, you draw an arrow down to a rectangle, and the rectangle maybe says, some instructions of what to do at that step. That's what you would be putting there. You're not going to put any kind of decision making. Decision making would go in this nice diamond shape here. Again, I'm going to show you examples of these. But any kind of decision making, yes or no, would go in a diamond. Okay. The lines with and without arrows to show the links. So if you have something that's connecting one shape to another shape, you're going to want to use a line or an arrow. Okay. I prefer the arrows, but that's just me personally. But that's completely up to you and your preference. And then I also have an example here on this sheet of, this one's a really busy algorithm. It's a very in-depth algorithm. Most of the time, my students don't have this much of an in-depth algorithm, but I wanted to kind of go over it with you just to give you some basis. So again, notice that this is an oval or an ellipse starting and also ending the algorithm, okay? I don't particularly care for the colors that are in some of these boxes, but I can also see why they did that because it follows the inclusion criteria, and also you can follow that blue color all the way down the algorithm to their outcome. So that's why that's why they did it. But anyway, so you would start with the top of your algorithm would be your ages of your patients, like the population, what they're presenting with, or where they're presenting. So if they're presenting in a primary care office or an urgent care setting, where do you picture your algorithm actually taking place? Most of your information for this is going to come from your clinical practice guideline, your RCT, and your systematic review. Wherever you developed your research from, you're putting it all together. You're pulling all of the pieces together to make an algorithm for your specific project, okay? So then the next thing that you would do is sometimes you'll have a diamond to differentiate a diagnosis, maybe to see if the patient is willing to go through with your implementation of your intervention. So it kind of depends. Sometimes it's back to a rectangle after the oval to show some type of process. So try to keep this as easy and flowing and concise as possible so that it's not overwhelming. This is a very overwhelming algorithm. I'm sure most of the information on here needs to be there, but I'll help you kind of fine tune it as we go. But this is a great example to kind of look at to see what the different boxes are. So also there's inclusion and exclusion criteria for these patients here. And this one says C box A because it's talking about the inclusion criteria. And then somewhere in here it should say C box B for exclusion criteria. So I'm sure that's listed in here. I'm not finding it right now, but that's okay. But anyways, and then C box C for palliative measures. Here's C box C. So, just going through these and making sure that you are matching your algorithm up with the different boxes that you're including is really important. So that's the first sheet that I wanted to show you. Now I want to show you an example. So this is an example of a student that I had in the past. With her permission, I am sharing this. So this is an algorithm that she's actually developed on substance use disorder. And she started out with substance use disorder that met inclusion criteria for the evidence-based practice project. And they're presenting to a primary care office setting. She says see box A and box B. So box A is inclusion criteria and box B is exclusion criteria. The diamond is the patient agreeable to substance use disorder treatment? If no, they're off protocol. If yes, you're going to do a process box. So the rectangle, it's a baseline assessment of the patient. And then she goes into what is a baseline assessment of a patient. So she goes into everything that you need to do with that. Also noting that she lists her levels of evidence here so that we know where she got this information from and where and she's also citing her resources so she's not plagiarizing. After this rectangle box, she goes into this rectangle box for another process box. She's going to do a urine tox screen, when they follow up, etc. And then the last part of her algorithm is a diamond. And this diamond, this decision is saying, is the patient abstinent from opioids and or alcohol? If yes, the outcome was met. If no, they're off protocol and you're going to refer them to a specialized treatment. And that's where she got that information from, her level 1 evidence. So this is a great example as to what I am looking for and the amount of detail that really needs to go into these. Don't get frustrated if you don't get it on your first attempt. I've never had anybody get it on their first attempt. It takes multiple reiterations and revisions to get where we need to go. So that is just one example there. And then this is her major recommendations paper that goes along with the algorithm that I just showed you. So what she starts with is what the appendix is actually in accordance with. So what levels of evidence did she base her algorithm off of? And then she goes into a little bit of just kind of an introduction to her actual algorithm. She, brings in some percentages as far as p-values and confidence intervals as far as how accurate this information is. And then she also talks about it has to be in the primary care setting to increase access for these patients. So she just gives a nice little background. And then she goes into the actual steps that are used in her algorithm. So the first step of the proposed evidence-based practice project algorithm is to determine the patient eligibility for treatment according to inclusion and exclusion criteria as displayed in box A and box B. Box C is displayed to expound on inclusion criteria to help clarify the process of the patient selection. And then she goes into every single step. So here's the next step, and then the next step, and the next step. And that's what you do. You just go step by step and write out your whole entire methodology for your major recommendations section of your paper. And then I just want to show you one more example. And this is healthy adults 18 and older with a BMI of 18 to 29.9 presenting with an infection that may require an antibiotic. And this was all about using probiotics for antibiotic-associated diarrhea. So first, again, using the oval here first. And her first one is a decision. Are antibiotics warranted? If they're not warranted, then you don't need to start the probiotic. So off protocol. If yes, does the patient meet the criteria to begin probiotic supplementation? So here's her C box A, exclusion criteria. If not, then they're off protocol. If yes, then we go into this process. This basically is her intervention. The probiotic, when to follow up with the patient. It also goes into this Bristol stool chart, which goes over what the stool's consistency is actually like to see if this is benefiting the patient or not. And then, was there a decreased incidence of diarrhea in those taking the probiotic supplement? Yes, outcome met. No, outcome is not met. So that's a very simple and concise example of a different algorithm that you can actually use. And again, when she goes to her write-up, she would just list every single step in a succinct manner, describing what she actually did with a brief introductory paragraph. And that wraps up your major recommendations section and also how to complete an algorithm. If you have any questions while you're moving through the process, please let me know.